So this small lecture series is going to look at some of the treatment options of basal ganglion disorders and dysfunction. Only a handful of learning objectives. Okay, so we're going to talk about Huntington's disease. Remember, it's a progressive genetic brain disorder that can cause uncontrollable movements. It can manifest as a severe decline in cognition and reasoning skills, as well as producing irritability, depression, and other mood changes associated with basal ganglial regulation. And we can also see destruction within the caudate nucleus, as shown in this figure. The increase in excessive movement occurs from an uncontrolled excitability of dopamine neurons in the basal ganglia. This uncontrolled excessive movement is called chorea, not called chorea like everybody else pronounces it. It's a Greek word that means dance, and it's pronounced chorea, as in choreography, not Korea geography. Okay? So in terms of the treatment options that exist, tetrabenazine is really the first FDA-approved drug for the treatment of chorea symptoms and Huntington's. It is well absorbed and is metabolized into two compounds, an alpha and a beta dihydrotetrabenazine, or DTBZ. And DTBZ is really the active compound. The alpha component's the active compound. The beta side is biochemically inert. Okay? The alpha DTBZ has been shown to inhibit monoamine uptake into vesicles, reduce dopamine release in the synapse, and possibly a few others. Tetrabenazine itself is metabolized by cytochrome P450, particularly CYP2D6, and therefore patients should be screened in order to determine if they are poor, intermediate, or excessive metabolizers. Deuterotetrabenazine is the degenerated form of tetrabenazine and appears to be quite effective for reducing chorea in patients that have Huntington's disease. The potential advantages of deuterotetrabenazine include attenuated metabolism and a prolonged plasma half-life, permitting less frequent dosing and lower dosing milligram sizes, as well as a more favorable risk-benefit profile. Tetrabenazine, however, can cause depression as well as suicide ideation, and so you have to monitor these patients initially because they may develop psychiatric disorders. Haloperidol can also be used to treat chorea. It acts by blocking dopamine receptors. It's an antipsychotic, and it has been used quite successfully to control agitation as well as psychosis. Excuse me. In patients with moderate chorea, the use of typical neuroleptics has largely been replaced by the use of some of these atypical neuroleptics or these atypical antipsychotics, such as risperidone, which offers both serotonin and dopamine blocking effects, and olanzapine, which offers serotonin, dopamine, histamine, and adrenergic blocking ability. These drugs typically have fewer side effects than the other drugs that were historically used. Nevertheless, you have to use caution because they can develop worsening of symptoms, especially in Parkinsonian features. The other symptoms of Huntington's disease, such as cognitive decline, are typically treated with acetylcholinesterase inhibitors. These are sometimes called mind-enhancing drugs or nootropics. Other symptoms such as depression can appropriately be treated with SSRIs. Anxiety can be controlled with SSRIs or benzodiazepine. And essentially, you are treating each of the symptoms that manifest themselves individually. A lot of these drugs are kind of the foray into the antipsychotic medications, and so don't worry quite yet if you don't understand how these mechanisms can relate. We're going to talk in great detail about all of these drugs in approximately 2 or 3 weeks. So dystonia is a movement disorder characterized by sustained and intermittent muscle contractions causing abnormal, often repetitive movements, postures, or both. The movements are typically patterned and twisting. Dystonia can be associated with abnormal activity in multiple regions of the brain, including the motor cortex, the supplementary motor areas, the cerebellum, as well as the basal ganglia. Treatment of dystonia is limited to symptomatic treatment, and so we can talk about anticholinergic drugs such as trihexyphenidyl or benztropine, as well as benzodiazepines. Anticholinergic treatment is initiated at lower doses. Anticholinergic side effects include, and we've already talked about this, dry mouth, blurred vision, constipation, urinary hesitancy or retention, tachycardia, and pupil dilation, as well as an increase in intraocular pressure. Additional side effects of trihexyphenidyl include dizziness, confusion, memory impairment, nausea and vomiting, and anxiety. Central side effects include memory loss and sedation, are typically dose-limiting. This is particularly due to trihexyphenidyl's additional mechanism of action as a dopamine receptor antagonist. Benzodiazepines are often used to treat dystonia. They modulate the GABA-A receptor and enhance the binding of GABA to its channel, allowing an influx of chloride into the neuron, which will inhibit transmission. Clonazepam and diazepam are the most often used due to their long half-life. Side effects include depression, confusion, and sedation, which can limit use. And we've talked about botulinum toxin previously in this curriculum, but I think it's a good time to review it again. Botulinum toxin is, of course, a bacterial endotoxin produced by Clostridium. There are 7 serotypes, A through G. Types A, B, E, and F are toxic to humans, while types C and D, of course, are toxic to animals, particularly poultry. Only types A and B are used clinically. Botox causes regional muscle weakness and paralysis. There are 3 different proteins in the snare complex that allow for synaptic vesicles filled with acetylcholine to fuse with the presynaptic membrane. Syntaxin, synaptobrevin, and SNAP25. Botulinum toxin A cleaves SNAP25. This prevents the snare protein from binding together so acetylcholine cannot fuse with the presynaptic membrane. Botulinum toxin B cleaves synaptobrevin, preventing vesicular fusion. Botulinum toxin is only temporary because new nerve endings will eventually sprout, making it only effective for about 3 to 4 months. Tremor is defined as a rhythmic and oscillatory movement of a body part in a relatively constant frequency and variable amplitude. An essential tremor is a type of postural and action tremor. Essential tremors can be treated with propranolol, a nonspecific beta blocker, or primidone, an anticonvulsant. Beta blockers are more commonly used medications for the treatment of essential tremor. Side effects attributed to propranolol include lightheadedness, fatigue, and bradycardia. Of course, propranolol will be contraindicated in patients with heart block or asthma. A selective beta-1 adrenergic blocker, such as atenolol, can be used instead of propranolol in patients with persistent bronchospasm, COPD, or asthma. Primidone has 2 active metabolites, phenobarbital and phenylmethylmelaminate. PEMA. PEMA may enhance the activity of phenobarbital. The mechanism of action of primidone in essential tremor is actually unknown. It gets converted into PEMA and phenobarbital, but neither of these agents alone appears to have a significant effect on tremor. It's thought to enhance GABA binding to its receptors, reducing neuronal excitability. Side effects from primidone were typically more severe at treatment initiation, but they can include sedation, fatigue, depression, ataxia, nausea and vomiting, dizziness, and confusion. Primidone cannot be stopped abruptly, however, and abrupt withdrawal may produce withdrawal symptoms. Propranolol and primidone have been used in combination to treat limb tremor in essential tremor, but the combined use of these drugs is possibly more effective than either one used alone. Some of these topics we will revisit again in psychiatry, and one of those is tics. Tics, and these are not the bugs that Dr. Richards teaches you about. These are repetitive, individual, recognizable intermittent movements or movement fragments that are almost briefly suppressible, but are usually associated with an awareness or an urge to keep performing the movement. They can be repetitive and stereotypic. Tics have a very complicated etiology. One thought is that the abnormality in dopaminergic processing can lead to excessive dopamine stimulation. Another view is that neurotransmitter systems have yet to be described in more detail, and those are the ones that we think may be involved. So we don't really know where they come from. Alpha agonists, however, such as clonidine and guanfacine, may actually be used to treat tics quite successfully. So what these drugs do is they bind to the presynaptic alpha-2 receptors, and they reduce norepinephrine release in the synapse. Side effects can present in the cardiovascular, respiratory, and CNS systems. Also, patients can exhibit hepatitis and hypersensitivity reactions to these drugs. Dopamine antagonists such as haloperidol or dopamine depleters such as tetrabenazine, which is a VMAT inhibitor, may also be used as a treatment option for severe tics. Side effects of haloperidol include anxiety, drowsiness, headache, abnormal movements, GI problems, and numerous rare and life-threatening adverse effects. In spite of all this, haloperidol is still routinely used as an antipsychotic and for a variety of CNS and psychiatric disorders. Tetrabenazine appears to have a relatively similar response rate. We can see a reduction in the frequency and the intensity of tics by approximately 2/3 to 3/4. It's also better tolerated than haloperidol. And finally, myoclonus is a sequence of repeated, non-rhythmic, brief shock-like jerks that are due to sudden involuntary contraction or relaxation of different muscles. There's a number of different types of myoclonus. Tics may respond to clonazepam. It enhances the activity of GABA, and it reduces neuronal activity. The most common side effect of clonazepam includes drowsiness and fatigue. These can sometimes be stopped by adjusting the dose. However, abrupt reductions or withdrawals of clonazepam can cause both an exacerbation of myoclonus and withdrawal-type seizures. All right, so this is it for the treatment of different basal ganglial disorders and dysfunction. Thank you.